Welcome to Clinical Conversations. On today's Smart Chiropractor Show, we have been highlighting a variety of our fantastic speakers from Axis 2021. That was our online clinical event, and we anticipate holding Axis 2022, this year's event, sometime in the fall. So keep your eyes peeled for our speaker list as well as the opt-in information. Last year, it was totally free. We had a paid option if you wanted to upgrade, but we had it live for free, and I believe we're going to do the same thing this year. We were fortunate to have a variety of awesome guests inside and outside of chiropractic, and today we're going to feature one of our guests outside of chiropractic. We had Dr. John Schultz, a medical doctor in Colorado who practices in the regenerative orthopedic space. He came on, and I'm going to play a clip here of us discussing why collaborative care is so important. So without further ado, let's head over. I'm going to be clicking a few things on my screen here, but we're going to take a listen in and a look at Axis 2021 with Dr. John Schultz describing the importance of collaborative care. Collaborative care and why it's so important. I know we have a couple, items that we have up here in terms of outcome and being everybody kind of sitting within their own specialty and focus, and really the collaborative care model of not letting the patient just try to figure out an incredibly complex system. But I guess if I just ask you that highest level question, why is collaborative care so important I'm going to say at large, and why is it so important to you with your experience in your practice day in and day out?
Well, here's a moment of vulnerability, if you will. Most MDs do not understand what chiropractors do. And as we all know, sometimes with lack of knowledge or ignorance, shall we say, there's prejudice. And regrettably, in our community, physicians and DOs at large, we're not trained about what incredible work chiropractors are capable of doing. We have no knowledge. And regrettably, there has been this big chasm between the two. Now, fortunately, I do not participate in that. I have lots of friends that are chiropractors that have taught me so much that I know their intrinsic value. I absolutely believe and actually subscribe to their values of less drugs, less medication management, no addicting products, and no steroid injections, because we know, and the science is really quite clear, that the steroid actually compromises the integrity of the tissue. So I've been fortunate that I've gotten personal training and fellowship, because the fellowship part is really important. There's nothing like having someone underneath their wing and go, listen. And I've had that blessing here in Denver and Boulder.
I like this whole, we're specialists in our own area of expertise. It's interesting. I know there's conversation about some chiropractors that sort of dabble in regenerative medicine kind of thing. Let's sort of lay out the concept of collaborative care where, we all have our specialties, we all have our lanes.
Yeah.
I'll be the first to say, I don't know any chiropractors that appreciate when physical therapists or other types of doctors or health professionals, start dabbling in what they'll call manipulation, what we'll call adjustments. They're like, wait a minute, that's our domain. And I'll say, to me, it's awkward that those in our field go out of our domain to go into your domain. What's your perspective on that? How should it be? How do you describe sort of our lane as chiropractors, your lane as a regenerative medicine expert, and sort of how they should work together on, I'll call it sort of the conservative care continuum? I know people, for example, will try chiropractic care before they come to see you in some cases. If they've waited too long, they may need that next level of care. Yep. In other cases, I know you get patients who come to see you, it's not bad enough for your care, and instead of going, sorry, we can't help you, you go, you need a chiropractor, and you'll in fact help them find one near them where they're local. I know you have an international practice, meaning people literally fly in from around the world to come to your practice. So I know you're always looking for, where can I send this person, whether they're not bad enough to need your procedure or whether they've waited long enough or the damage is enough, they have your procedure but then need follow-up care afterwards. paint sort of your vision, your ideology, your perspective of, what do those lanes look like, and, for doctor, and what's the patient journey from your perspective?
So let me tell, I think, and that was a multi-pronged question. So I'm gonna attempt, Jason, to break that down. Let's just talk about lanes, and then let's talk about collaboration, and then let's talk about the patient experience. So for 16 years, we've been doing this. And how is our practice different than the majority of practices out there? Number one, this is all we do. Okay? We don't do Botox on Tuesdays, fillers on Wednesdays, and lipoaspirate on Thursday. We do high-level PRP, stem cell to all the joints of the body every day, and we work at night and the weekends about it. That's all we do, first and foremost. We don't prescribe narcotics. We don't do ablative procedures like a radiofrequency. Number two, our system is different in that we have a university-grade lab. Why is that important to you as a provider and a patient and a family member? It's because we can customize the PRP and the stem cells for you. In other practices, they use kind of a daiquiri mixer, sort of a blender. And the problem with that is one size fits all, which we know doesn't work. Number two, we have what's called imaging, and every single injection we do, even one in the toe or in the thumb, is always under guidance, because we believe that you can have only the best results when you have precise injections. Number three, we have an approach like many chiropractors where we look at the entire body as a unit. We call it the SANS approach. It's symmetry, articulation, neurologic, and stability. It's only when you take off the blinders of the orthopedist, hey, I'm only looking at your knee. Don't talk to me about your ankle. If you got a back problem, hey, it's 2 doors down on the left. So that's our lane. We do evaluations. We do high level of injections of precise injections with custom platelets or PRP. How does this work in terms of collaboration? We have, as you mentioned, thankfully, patients from all over the nation and actually the world. And so what I look for in collaboration is simple help. We desperately need other providers, other chiropractors to assist us in the management. Some patients will come to us they'll come to us and they haven't had appropriate chiropractic care. And guess what? They don't go to Marvin's Gardens, and they certainly go to Boardwalk. They got to go back, because we believe in the importance of chiropractic care. We believe that all these are stepwise and critical. You don't get to go to stem cell first, second, or third. And then we also, after the injections, we need help. We can't be everything to everybody. And so we are looking for people that are interested and committed to getting the patients better. And we have a large number of patients. We're just looking for people. For example, recently in the state above us, Wyoming, we had a patient that had some treatment here. We can't provide care. We didn't know anyone, so we went on to the Smart Chiropractic Care Network, and behold, we now got a provider to provide that type of care. Home run, right? And that's what we're looking for. What does this look like from a patient model? COVID has taught us many things. One of the things is that we can do a telemedicine evaluation. And during that, from a beach or a cabin, we spend, and this is what we do for the majority of our patients outside of the Denver area, is we spend a significant amount of time during which we recount their history and all their treatment, including chiropractic care, the results therein. We review the MRIs in person. We're not dependent upon a radiographic report. We actually look at each MRI, and then we tell them the treatment plan that we would recommend And, are you ready? We tell them their candidacy. We are transparent. We're not looking for the next buck. In fact, we don't believe that one and next, repeat and rinse, repeat and rinse, repeat and rinse is a viable or appropriate model. We believe in continuity. We believe in building a base of patients and their families so we can continue to get them better. So we're looking for long-term, successful providers throughout all of the nation and the world to help us secure this goal.
That's awesome. Thank you so much, Dr. Schultz. I think that really sets the stage for really where we're going next, which is, the current state of affairs, what's going on in the regenerative and orthobiologic space. There's so much to dive into here. One thing I want to bring up from what you just said that also is a stark contrast is I think we've all either experienced ourselves or certainly, been tagging along for that 30-second doctor visit, right? And it's like, sometimes that can be so demoralizing, especially as healthcare providers. We're like, man, how you're guessing, right? It's like, and really being able in your practice to take that amount of time necessary to really understand what the patient's going through, to understand what challenges they might have and what their goals are in the future is so critically important to being able to craft that care plan, which meets or exceeds their expectations. So I just want to give a special, a shout out in recognition to you and your practice for having constructed it in a way that I think all of us as healthcare providers is the type of practice we'd want to go to ourselves. And I think that's so important. So thank you. And I'll
thank you. To that extent, two other things. This is not a churn and burn. We spend, as I mentioned, quite a bit of time, and it's us. This is not a mid-level. This is not an LPN. This is us.
A great interview with Dr. John Schultz out in Colorado. And my big takeaway from that is just the understanding that as movement-based healthcare professionals at the highest level, which is what we all are as chiropractors, many other MDs, DOs are interventional by nature. Who's taking care of the patient the rest of the time, aka the rest of their life, really being able to help guide and direct them in the best manner possible with how they're moving, how they're thinking, what they're eating. So important. We can be that key link regardless of what type of medical provider they're seeing. The good news is that it's interventional, but meaning that they don't need to see the medical provider necessarily every single week, every single month for the rest of their lives in most cases. But it's on us. We have to take that territory in a good way by helping people understand that we are those providers that they should be seeing time and time again, whatever that means for you, your patients, your findings, their health goals, whatever you're putting together in that care plan. It's important for you to accurately discuss that with your patient because bottom line is nobody gets younger. We all get older. Injuries happen and gravity is undefeated. Those are my big takeaways. Jason, how about yourself?
I think a lot of the people in the profession sort of have the opposite perspective of collaborative care. At first, it seemed like the main motivation to collaborate was because chiropractors benefit by collaborating with medical doctors, whether it's for credibility factors, whether it's for referrals. It was a professional benefit to collaborate. What I like about John's take here, Dr. John's take here, is that it really is about the patient or the person's benefit. If you've ever been a patient yourself, if you've ever been someone who needs care, it's the fastest way to recognize and learn how broken the system is. And so to have, from a healthcare perspective, to have an attitude of wanting to be of best service to the people who need our care, the answer is we're at our best when we're able and willing to collaborate with the other professionals, our patients, our clients, the people who come to us. If we can work with their other providers, then that's better for the patient. That's better for the person. That's better for so it is, I think, not so much for our benefit because we get more credibility because, the medical doctors accept us or think that we're okay or validate us, but it really is another level of being of service to the people who come to us. They're the ones that need professionals to work together and simplify a plan for their benefit. We're at our best when we do that.
Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.